go, go, go. That's the birthday. That's the birthday. I got sunshine on a cloudy day. When their moms out there dying, we got stuff to say. What's up, Z-Pack? I am in a singing mood because today we're talking about maternal mortality, which is one of the most depressing and horrific topics that we could talk about, but we're actually optimistic because we think we can make a difference in moms' lives, meaning that they will not die in or after childbirth, which seems to be happening quite a bit in the US. And let's bring up your comments. We've linked to the article from NPR and ProPublica that we're talking about today. And of course, when anything goes wrong in healthcare, who do we blame, Tom Heineber?
Well, the liberal media out there blaming the nurses. Stupid liberal media.
Damn liberal media.
And the conservative co-hosts are blaming the liberal media. So it's a circle of doom.
Yeah.
Really is what it is.
Listen to Alex Jones, people. He'll tell you what's really going on with this country.
There's chemtrails and Martians and the lizard people.
Don't do that. Don't listen to it. Don't do it.
The lizard people. Okay, guys, this is a serious topic. We posted the article earlier, and it was an NPR piece today talking about a study in the very illustrious The American Journal of Maternal Child Nursing. So it's a nursing journal, and the clickbait title of this NPR piece is "Many Nurses Lack Knowledge of Health Risks to Mothers After Childbirth." And the implication being that it is nurses that are responsible for the ridiculous rate of maternal death we have in the US. Let's show that graph, Logan. This should make you freak out and also become... There it is. Okay, these two jokers
scary.
next to me are constantly dissing Europe and everyone that isn't America, but America rocks at killing moms. So where everyone else in the developed world's maternal death rate around childbirth has declined, ours has gone up.
You know why that is? It's because they're all gay in Europe. So.
And having abortions.
Yeah.
I was going to say, Tom, that I suspect it's because they treat health as a systems issue. If a single mom dies in Britain, for example, in or around childbirth, in the peripartum period around childbirth, they treat it as a huge potential failure of the system, and they descend like vultures. They have public hearings. They do something about it. Whereas, here's a good example, in Great Britain, they've had like 2 cases of preeclampsia, which is pregnancy-related hypertensive disorder that progresses to eclampsia, kill moms over a period of a couple years. Whereas in the US, we lose 40 to 70 moms a year from eclampsia and preeclampsia-related.
I got a graph for that.
Now this is not it.
Damn it.
I like your hustle, Logan, taking the graphs that I gave you, but that's actually for a later time. And in fact, it cuts to the chase a bit of what is our actual understanding in healthcare providers on the front lines who actually take care of moms. Do they understand what the leading killers of moms are around the time of delivery and after delivery? And when are most moms, if they die, when are they dying? And first of all, let me back up a second. Why are mothers dying at a higher rate in the US than is in any way acceptable? And let me tell a story that was actually published in a previous NPR piece that many people sent me a few months ago. And actually, this will resonate with a lot of people. It'll resonate with you, Tom, because it was the story of a doctor, which of course won't resonate with you because you're a loser. I'm kidding. I love Tom. He's smarter than he looks. No. He's married, however, to a genius NICU nurse, right? Now, it turns out that this was the story of a doctor who was married to a NICU nurse. And that NICU nurse gave birth in a New Jersey hospital that was known for its lower rates of C-section, its great outcome scores, and all these other things. So it was, by all estimations, a good place to give birth. This woman was young. She gave birth to her child, and she was dead within 24 hours. And what went wrong? Her husband was a doc. He was watching, and this was the story. And this is illustrative, I think, of how we dropped the ball in the US on maternal care, and we're letting our moms down, and by extension, the next generation, because now this child, Haley, her daughter, is growing up without her biological mother. So this is what happened. They had birth, they gave birth. on admission, mom had a blood pressure of around 140 over something, which was kind of, they were like, well, she has no history of hypertension, but the criteria really for worrying about preeclampsia, which is this pregnancy-related high blood pressure that can lead to all kinds of problems in pregnancy, kidney failure, seizures, very bad hypertension with stroke and death, a lot of very dangerous things. One of the criteria could be a blood pressure around 140 in someone who doesn't have a history of high blood pressure. Well, this was sort of missed or ignored. She gave birth and afterwards complained of epigastric pain that was getting worse and worse and worse, the classic 10 out of 10 pain. Now, she was a provider in town, right? So she is a NICU nurse and her husband was a doc. And this is what happened. They told the doc said, give some antacids, it didn't get better. They check her blood pressure, it's like 160 over something. They're like, one of the common misconceptions, Tom, and Logan, that you guys may not be familiar with is a lot of doctors of my generation and older were taught that the way you cure preeclampsia is you deliver the baby.
That's what they told us.
So tell me, your wife had preeclampsia.
Yes, she had preeclampsia since I think the start of the second trimester. And so she's normally like a 110 over 70 kind of person.
Yeah.
And it instantly went to like 140s, 150s. And then finally when she was, we were about 3 weeks out from the actual due date, and she, like her limbs started feeling numb.
Wow.
And her lip was numb. So we called and tried to get into the delivery room. They told us to basically go away. And so we went down to the ER. And he took her blood pressure. It was 190 over like something insane. Yeah.
Wow. Did they do urine testing for protein and all the other stuff? Mm-hmm. Yeah. Was it positive?
I'm not sure.
Yeah. So here's a great example, and Logan is a good example of where these things are missed. You blow them off, they have these symptoms. Oh, it's just status hystericus or status dramaticus in a first-time mom who, she never had pre-existing hypertension. So that is a high-risk pregnancy and a diagnosis of preeclampsia and pregnancy-induced hypertension, depending on whether there's the other criteria, all of that. So that being said, you have firsthand experience with this.
Oh,
yeah.
go ahead. No, go ahead.
Yeah, and they never, like our OBGYN never called it preeclampsia. She said it was, we'll keep an eye on it, whatever.
Right.
And then like even right before, like we had an appointment like a couple days before, and it was like 130, 140 over something.
Yeah.
And all of a sudden it was not 190.
Did they call it pregnancy-induced hypertension or any
Yeah.
other thing? Yeah,
Mm-hmm.
yeah. So we'll talk about that in another show because it's out of the scope of this, but suffice it to say, there are a lot of things that can go wrong in pregnancy, plenty of things that go right regularly, but the things that go wrong, modern medicine can be very good at actually treating. In the old days, preeclampsia could be very fatal.
This goes into my question.
Yeah.
It's sort of a layman's question. Janet in the comments says, pregnancy is dangerous, period. So is it your opinion that pregnancy is just always going to be dangerous because of the size of the human birth canal and just because we're bipeds? Or have we gotten over that with modern medicine?
Well, I mean, the answer is found in the European data where pregnancy, as dangerous as it is, they have great outcomes. So we know that we can do better. We know that modern medicine can actually treat women with the attention and intensity that they deserve. And one of the theories actually is why our maternal, and I'll finish the story too, why our maternal death rate is higher now, increasing in the US, is so much focus has been placed on reducing the infant death rate. And that has been tremendously successful. So we have maternal fetal medicine docs who really are good at saving kids even in utero. We have, and diagnosing them, we have amazing NICU and pediatric intensive care staff that can whisk away a baby, and they're very highly trained and they're very good at what they do. Where have we dropped the ball? Mom is sitting there, right? And she potentially could be a ticking time bomb of something bad happening if she's not educated, if she's not familiar with finding signs, and if the staff around her aren't looking for those things and are going on a sort of an autopilot that many times we do when we're overworked. Now, in this story, this woman then developed full-blown HELP syndrome, which is a variant, the extreme variant of eclampsia, where it's hemolytic, and the reason it's called HELP, H-E-L-L-P syndrome. And as a hospitalist, I've consulted on this syndrome many times in the hospital. The OB guys will call me and go, we have a case of HELP, we need some help, we manage it, but we'd love to have some medicine support on the background here because this is a very dangerous and scary syndrome and we need the specialist to come in and that kind of thing. Recognizing that and calling for help is a key thing, no pun intended. HELP is hemolytic anemia, elevated liver enzymes, and low platelets. That's the constellation of syndromes. And with that can come bleeding, horrible high blood pressure, the other things that go with eclampsia. This young mother died of that. It was unrecognized. They kept blowing it off and the husband was worried, and his friend was telling him, who's a trauma surgeon, saying, I think this is help. And they did labs, and the labs were not really abnormal. And he said, I have a really bad feeling. The intuition is that this is something bad. And she's doubled over in 10 out of 10 pain the whole time. We forgot to turn off the AC, didn't we?
Yeah.
We suck so much.
It's chilly,
we need
though.
a checklist, speaking of, right? And it gets to that. It's like 60 degrees in here. So he was sort of asking for help, and finally she starts to have symptoms of a stroke, where she suddenly becomes calm. She's not complaining of pain. Half her face is paralyzed. She can't lift her arm. He's doing a neuro exam on his own wife and diagnoses her with what ended up being an intracranial bleed, and soon she's dead. And now and the only video that he has of him with his wife and child was right after birth. He took an iPhone video, and it's in the article for NPR, where she's holding the baby and smiling, and they're looking at each other. And that's all that he has to remember his wife, the mother of his child, by, because this shit was dropped, right? And this is exactly, and multiple nurses came through, the doctor came through, all of this stuff happened, and it was still missed in what we love to call in America the greatest healthcare system on the planet. And we can't match Great Britain for the outcome on this, because we don't think systematically. We don't think could there be holes in our global, the way that we treat these things. We don't look at the bigger picture a lot of the times, and then we miss the unique individual in front of us. And I bet you those poor nurses who were taking care of her were clicking the boxes to get the patient throughput, to make sure the patient satisfaction. They gave her a ton of Dilaudid, that's for sure. It didn't help, right? So all those things that they're conditioned to do now, right? And now she's dead. And so who's to blame? Well, now this media article is like, well, the nurses could be educating better. Yeah, that's true. The doctors could be educating better. We could all have a better public health approach to maternal issues, and we could actually train people better. That's where the biggest problem is, right? We're so focused now on the child survival, which is great, that we're missing the moms. We're not screening for, postpartum depression, hypertension, et cetera, et cetera, et cetera. So now with that...
Real quick,
yeah.
Holly Stevenson agrees with you, and she says, I'm a passionate L&D nurse. The problem starts long before postpartum. Our highly interventive pregnancy and labor management puts women at risk for these postpartum complications. Looking at our induction rates and C-section rates compared with other countries means compared with other countries, our postpartum complications are going to rise. Maternal mortality is way too high in this industrialized nation because we are intervening too much, also a result of take a pill and make it better mentality. So education among nurses and docs is important, but education about the ramifications of unnecessary interventions, as well as the risks and how to recognize them for an appropriate and life-saving interventions, is where we need to start.
So now this is the perspective of an L&D nurse who is part of the obstetrical industrial complex in the U.S. that is very interventional, it's true. However, what she's saying is actually quite controversial, because you need to actually look at evidence. Do these interventions actually cause worse outcomes and more complications? C-sections can have bad complications. They can also prevent bad complications. So using them judiciously is actually a smart idea. This is actually an incredibly nuanced topic, and you will have obstetricians who will fight tooth and nail and say, no, what we're doing is appropriate, and others who will push back. And then you have the kind of home birth people that are like, I want to give birth in a bucket.
A river.
A river at home. And it's like, I'm going to tell you right now, I have plenty of respect for everybody in the world. I would never, neither would my wife, knowing what we know about the potential complications of pregnancy, ever, ever, ever let anyone deliver our child who isn't either a really good midwife or an obstetrician and have really good access to the best that Western medicine has to offer, either close by or in a hospital.
My wife, who's a NICU nurse, says that she will not deliver at a center or a hospital that doesn't have a level 3 NICU.
Yeah.
It's not going to happen.
Right. And she's thinking about the child. She's not even thinking about herself.
Right.
So the story that we had, and we still haven't even gotten to the article, but I mean, again, it provokes so much emotion in people because, Mrs. Dog and I, she gave birth to our first child at Stanford. We had an amazing L&D experience. Like, really, that nurse just killed it. Why? It's a 1-to-1 or 1-to-2 ratio. She was really good at what she did, really good at holding hands and pushing people through and counseling and coaching. Then we go and get the postpartum stuff, and it was just, we felt like, are these guys even paying attention? Like, they're not really that interested in mom, and the kid is doing okay. And we just felt like it wasn't as on point. Now, of course, we're pretty critical because we're both annoying doctors, and we only stayed 24 hours because we left kind of AMA because it was Christmas Eve, so we're non-compliant a-holes on top of it. But it worked out, but we saw kind of, man, it gets dicey, and which nurse you get, which doctor you get, when they round, what their bedside manner is, are they breast milk shaming mom, are they doing, there's so much nuance.
But Z-Dog, giving birth on all fours is like the most natural because it's like animals, bro.
Yeah, Z.
Yeah, and animals have like a when humans gave birth in caves, their infant mortality was like 80% or something.
Also, they have like a 3-to-1 birth canal. We have a 1-to-1 birth canal,
Yeah, let me just tell you, giving birth is a dangerous thing. It used to be a lot more dangerous, but it is not a pathological condition. Some people want to make it a disease, right? It's not a disease. It's a very natural thing. The thing is, we can help keep people safe if we are actually paying attention. Now, speaking of that, so the NPR article basically says that this study in this American Journal of Maternal Child Nursing, they basically, and I read the exact study. I went through detail to detail, and the first thing I looked at, like we talked about the other day when you're analyzing a study, Logan, pull up the thing that's all highlighted, the little image that's all highlighted. Yeah, that one. There it is. Always look at the disclosures. Who's getting paid, right? So this project was supported by the Association of Women's Health, Obstetric, and Neonatal Nurses. So that's a big organization, right? It's called AWHONN. And funding from, dun, 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 Big Pharma. Merck. And look at these monsters at Merck. Look how they're biasing this study. Merck for Mothers, the company's 10-year, $500 million initiative to help create a world where no woman dies giving life. Oh my God. Merck.
How dare they?
How dare you with your pro-mother agenda?
You are Merck monsters. Crap, pharma. So here's an example of maybe pharma money studying something that might actually help. So that's why you don't paint everything with the brush of evil. You look for nuance in the world. That's part of the mantra of this show, all right? Nothing is black and white. Only a Sith deals in absolutes, Anakin. So that being said, we see who's kind of funding the project. Now we look at what kind of trial it is. It is a cross-sectional observational study. This is what that means. It's not an experiment where you're making an intervention somewhere. You are measuring a cross-section of a population at a given point in time. And you're observing that, and then you're commenting on the data and analyzing the data. And this is what they observed. They observed 372 nurses who were part of AWHONN, this organization. Okay, so already there's some bias because it's nurses who are already part of this thing. They are specialists in caring for women in postpartum period. And I think 30% of them had advanced degrees, graduate degrees in nursing. Are you looking at my butt, Tom?
Butt cam!
There's the butt cam. There it is.
He missed the butt.
I missed the butt cam. A lot of them had advanced degrees. The majority of them were older than 40 and had greater than 10 years of experience. So these were not, flash in the pan nurses, and they study them using a survey, using SurveyMonkey, which seems a little ghetto, but apparently it's legit. So they use SurveyMonkey, and they asked these guys a bunch of questions about how they educate moms. And they went in with the hypothesis that maybe nursing education around the time of delivery is deficient, and that's leading to more maternal deaths. And so they asked a series of questions to see what are these nurses' understanding of the teaching points around maternal dangers, post-delivery, and what are they doing around teaching? Like, what are the strategies they're using to teach? And let me just go through it real quick. So basically, let me pull this up.
Julie says, SurveyMonkey, ghetto as fuck.
It's ghetto as fuck, isn't it? Like, I'm not gonna lie, I read that and I'm like, I don't know if I can take this article seriously, right? You really use SurveyMonkey? But I mean, maybe it's a thing. I don't know enough about it to discount it as a scientific tool, but I will say it felt ghetto when I read it. So again, read the article, right? So what's interesting is they start by talking about how they started this. They did a literature search in PubMed. And nowadays the articles actually, as part of their methodology, they talk about the lit search that they did. So in this article they say, a review of research in PubMed and SynHall using the search terms that included postpartum education, discharge teaching, postpartum complications. This is how they're getting background for what studies have already been done on this question of how is nursing teaching of patients affecting maternal mortality. And it turns out there just wasn't that much done, but there was a few sort of small things that implied that there could be improvements in this space. So they said, okay, let's go ahead and do the trial. Now, they start also by saying, look, in the postpartum period, moms are in pain, they're exhausted, they're overwhelmed. Any teaching you do, many nurses, and we saw this in the comments, many nurses will say, they're not receptive to this. They don't want to hear about all the ways they could die and all the things they should look out for. They're worried about the baby, they're exhausted, they're emotional, everything that happens postpartum physiologically and mentally, right? And so it's a difficult task to begin with.
Think about how much they have going on. Like, they're worried about like breastfeeding, right? And then being shamed for not breastfeeding, and then all that kind of stuff that goes into it. Not having a natural childbirth. Like, why should you like scream in pain? Like, get the epidural, yo.
Oh, hell yeah.
Support you girls.
Hell
I'm not
yeah.
doing it.
I'm all about that epidural. I got an epidural just in sympathy with my wife.
Did you really?
And I only pissed myself twice. That was what was amazing, I'm joking, only a little. So the interesting thing about this survey, they sent it out to 3,700 nurses, okay, by email, because they have this database in Awhonn. I don't know really how to say Awhonn, AWHONN, and then about 30% opened the email. So, MailChimp, SurveyMonkey, they have these things where, like, when I send out emails, if you join my email list, I can tell the percentage of people who've even opened the email.
Don't join it. It's lame. Don't do it. Email lists are lame.
My email list is totally lame because I'll send you an update every week on all the dopeness that happened. You're lame, Tom Heineber. Anyways, so
spam.
Of that, 30% of those 3,000, so 1,100 opened the email, and then only 30%, 37% of those actually responded. So 416 responses, and of those, only 372 actually finished the survey. Now, where do you see bias here?
All over the map.
All over the map. So this is the thing with surveys, right? You have a response bias. So there's a selection bias. So the people who are most likely to answer that survey may have some characteristics that are different than the vast majority of nurses. So
That's
they
right,
may be
because the only people that answer surveys are losers.
total douchebags.
And bias is a liberal construct. So,
Yeah. When they're like, only 25% of Americans believe the Earth is round, and you're like, 75% of Americans believe the Earth is flat? And it's like, no, it's just 75% of the dummies who picked up the phone who had nothing to do Wednesday afternoon.
Looking at you, Helen.
Yeah, I've seen some compelling data on the YouTube there.
That's a loser selection bias.
Exactly.
In this case, it's probably a gunner selection bias, like the nurses who are like, oh my gosh, I'm totally going to fill this out because I'm going to crush it. So again, I'm making this shit up, but you can see where the biases could happen. So the bottom line is they do this survey, and let me show you. Show me the chart, Logan, where it's like brown and it's got different rows. That's it. You're so smart, Logan.
Yeah,
and so this is what the respondents felt were the most likely top 3 causes of death in the peripartum period, or the most common problems with morbidity: postpartum depression, hemorrhage, and what's the third one there? Infection, and then venous thrombosis, hypertension, preeclampsia, eclampsia, pulmonary embolism, etc. Now, there's another chart, Logan, where it's actually got the real answers. It's
is this
that
like The
one.
Price is Right?
That one. There it is. Yeah, it is like The Price is Right. This is the actual truth. So the number 1 cause of pregnancy-related death in the U.S. is cardiovascular disease, often pre-existing, right? So, you have an event around the time you deliver. The second most common cause is other medical non-cardiovascular disease. So other comorbidities, pulmonary disease.
My wife's giving me shit.
Is she? She mad
He
at you?
said Logan would have totally let me die. Luckily, my sister was in the room.
Yeah, as soon as Leah gave birth, I was just like, oh yeah, she's fine. So I went to go check on the baby for like an hour. And apparently she had an epidural and they missed the first time, so they gave her another one. And then the second she got back to the bed, they pumped her full of Dilaudid, and she passed the hell out. And so Tom and my sister-in-law were in the room, and my sister-in-law, like, the machine starts going off, and the nurse is like, oh yeah, it just does that. And so like she complains at her like 3 more times, and she's like, fine, what? And my sister-in-law's like, yeah, her heart rate's 20.
Wow.
And they're like, oh, let me grab a doctor.
Yeah. That would be an anesthesia complication, which is something like 0.2%. It's at the very right. Can we show that graph again, Logan?
Bam!
There it is. There it is. Anesthesia complications.
That's you, girl.
That's you, girl. I love you, girl. I know Logan, though. Logan's so emotional. He was like, don't you die on me! Don't you die on me.
I wasn't even there.
Actually, he was texting me with some results, and I was like, dude, you gotta pay attention to that. And they got good care. And actually, your wife went in, right, Tom, and helped out a bit.
Yeah, she did.
Yeah, 'cause my wife's, her NICU's right down the hall.
Yeah.
So
Tom's wife's NICU
She went
nurse.
to check.
And
Sent
so,
in the troops.
So even when you're connected, ish goes wrong.
It's true.
It's very, very tough. So the actual causes are actually different. So one of the conclusions of the study was, well, these nurses that are taking care of these patients don't actually really have a good sense of what are the big issues around the peripartum time. And going through the rest of this survey, they found that, let's show me the teaching, it's like a bar, it's like a weird pie graph. The pie graph, there it is, that one. There it is. So this was the result of when they asked, okay, how much teaching are you doing? How much time are you spending doing discharge? Saying, okay, these are things you should look out for mom. Forget about baby now, just mom. Like, should you worry about bleeding? Should you worry about infection? Should you worry about blood pressure? Should you worry about leg swelling? Those kind of things. And this is the time spent. Now, does this surprise any nurse in my audience that a lot of people are spending less than 5 minutes. A lot of people are spending 6 to 10 minutes at most, because when you're in a volume-based economy of Health 2.0, you're not going to spend time with patients. Now, there's data in heart failure and other things that nurses have a huge impact on education. Early on, people were making comments, well, isn't it the OB's responsibility to do this teaching? Yes, but nurses are better. They are honestly better because they're there all the time. They're on the front lines. They're at the bedside. They are still the most trusted healthcare profession, and they can do a wonderful job. And when they do it, we see a reduction in readmissions and improvements in sort of things like CHF. So the question is, if you did a prospective trial on this, you might see a real change in outcome and a drop in maternal trouble if we actually are educating appropriately. Now, it says, here's another issue that the survey found. Nearly half of the nurses who responded to the survey were unaware that maternal mortality has risen in the US. And it turns out that the ones who were most aware were the oldest ones, because they were like, damn, things have gotten worse. They could see by perspective, right? And what do, especially at these like magnet institutions? We let go our most senior nurses and bring in newer nurses who then can't benefit from the mentorship of the older nurse, and it's all about the almighty dollar. Right? So are we hurting ourselves again in the US systematically relative to other countries by not valuing our nurses on the front lines? I would argue yes. Only 12% of the respondents knew that the majority of maternal deaths occur in the days and weeks after delivery. Did you guys know that? If you're going to die in a peripartum period, 61% of people who die around childbirth die after delivery, in the period of days and weeks after delivery.
And that's why Brenda Watson says every new mom deserves a home health mom-baby visit.
Oh my gosh. So Tom, don't let me forget, before we wrap this, I want to talk about ideas we can actually implement to make this better. One thought I have is a telehealth visit. So mom pulls up Skype and goes, okay, I'm feeling crap. Wait, I hear my leg's a little swollen. Everything's great, the baby's great, everything. My leg's a little swollen, but otherwise, wait, show me that leg. Oh crap, show me the other leg. Shit. You could have a deep venous thrombosis come in right now. Get your husband to grab baby, or if you're a single mom, we'll send somebody over to you right now. That's one way you can help head these things off at the pass. The second, of course, is education at the time of discharge and then continually. Right now, the average sort of follow-up is 4 to 6 weeks for a vaginal delivery for mom. Right?
Yeah, that's what ours was.
Right. And if you have a C-section, it's a little bit faster.
No.
But even then, it's not nearly fast enough to catch something if mom's not aware.
Yeah, wasn't your wife a C-section?
Yeah, it was like 6 weeks.
Yeah, it's crazy.
And the OB didn't even deliver because she doesn't work Saturdays.
Yeah. That's the other thing. The weekend effect is in full effect. So this woman who died in the NPR article delivered on a weekend, and they had trouble getting specialists in, et cetera, et cetera, et cetera. It's a real problem, you guys. So in the setting of this, they spend less time on education because there's so much else going on. What is the answer? Now, there are a lot of great comments from L&D nurses and from other nurses, right? We need better training, we need better, we need more time for our nurses to spend, and we need to educate our nurses as to, hey, here's the update on what's going on in maternal mortality. They're dying more. and we can do something about it. We can actually actionably save lives and give a huge aura and purpose, even more so than what we do on a daily basis, right? This is absolutely something actionable. Now pull up
Oh, snap.
the one that doesn't look like it's a patient handout. It's just a list of things.
Oh, I got that, Z.
Yeah, there it is. So this, guys, is our sort of action item teaching point here, and that is that there is a list of issues, right, that you ought to be looking for postpartum after delivery, and we should be telling every mom to worry about this stuff and telling dad and telling family, look out in your wife for this stuff. Pain in your chest, because, why? It could mean one of those cardiovascular complications that we were talking about. It could also mean a pulmonary embolism, a blood clot that's very often seen. You can often get them postpartum, right? Going to the lung can cause chest pain like that. Throw the graph back up. So number 2 here, constricted breathing or shortness of breath. Well, that goes with either heart problems, heart failure, etc., infection, or that same pulmonary embolism, the blood clot to the lungs. Seizures. Well, if you're having seizures, could you have developed eclampsia, right? Or another issue related to hypertension, etc. Entirely possible, especially since many people are misinformed that when you deliver, the eclampsia goes away. Not necessarily true. The next one is thoughts of hurting yourself or your baby. What's that about, guys?
Yeah, Tom. Tom tries to kill my baby all the time.
Postpartum depression, postpartum psychosis.
Yeah, we don't screen properly for that. It can be fatal, right? And we've seen that. Bleeding that is soaking through 1 pad an hour or blood clots the size of an egg or bigger. Again, postpartum hemorrhage, one of the other leading causes of death. An incision that isn't healing, that's a post-surgical, especially either a episiotomy or a C-section wound. A swollen leg that's painful or warm to touch. Blood clot, you're worried about. Temperature of 100.4 or higher. That could be blood clot, infection, embolism, etc. And then headache that does not improve even after taking medication, or bad headache with vision changes. Again, you're thinking about eclampsia. So this is what we ought to be teaching, nurses and medical students and staff, and saying this is how over time we got to teach our patients, look out for this. But then if we have a telehealth visit or some kind of check-in with them where we can see, are they having any of these things? Keep pounding it in the head, like, look out for this stuff. Don't ignore it. Never ever ignore it. And then there's a handout you can actually give a patient. You see that funny one with the red on it, Logan? Pull that one up. There it is. Save your life. Get care for these post-birth warning signs. And you've got, call 911 if you have pain in the chest, and they have a little acronym, POST. Obstructed breathing, seizures, thoughts of hurting your baby. And then call your healthcare provider, so less urgent, bleeding, incision not healing, red swollen leg, etc. This is one easy thing, right, that you could start with, assuming your patient is literate, they have some support, right? And a lot of people don't. That's where you have to get the public health apparatus involved. It's not easy, social work, case management, etc. Thoughts, Tom Heineber?
I feel like I can fix this. I'm going to become a doula / spiritual healer / midwife.
What the hell is a doula?
What's a doula? Oh, tell them what a doula is.
A doula is like a baby doctor that's not a real doctor and might kill your baby.
That's retarded. Mm-hmm.
I could not have said that better myself. That's actually spot on. Like, I got mad love to my midwives out there and the doulas that work with docs and midwives, and that's great. But there are some people out there in the alternative birth industrial complex that are just plain dangerous.
But Z, I want to give birth in a river because it's natural.
Oh man, that's Game of Thrones type shit, Logan.
Can't you just imagine the moment when a salmon crests the stream right as my kid comes out of my vag?
There's actually a YouTube video. There's a YouTube video with this lady giving birth in this filthy ass river, and all her kids are running around naked.
You know what I love is you two assholes mansplaining birth of any kind.
Goddamn right.
Like, our audience is like 80% women, and they're, yeah, you just, salmon are thinging and vaginas. What the hell do you guys know? Tom knows shit about birth. Logan knows. He was there.
I know.
He was there.
He was there.
He done seen
2,000
it, y'all.
years ago when the strength of men failed, Gandalf. So, guys, I think the punchline here is don't blame nurses for this shit, but we can help nurses actually save lives because they're on the front lines. We need better support for doctors and nurses and patients in this peripartum period, and we as a country have to do better because this is absolutely humiliating and not acceptable for an advanced civilization, right? We can't let the Brits. Who else is beating us? Show me that first graph, Logan, the one with the
so
lines.
many damn
Okay, I'm going to tell you who shouldn't be beating us here,
Wait,
because this is just
wait.
making me like get hell of America pride.
Portugal,
Okay, Portugal. Come on, dude.
Deutschland.
No. Ireland? Okay, that's kind of dope, actually. The Irish are dope. I'll give them that.
Yeah,
The
they
Netherlands beat us at everything, except for being cool. Yeah, no, it's not okay. This is not okay. So we can do better, guys. Anyways, hit share on this. It really helps spread the word. Do you guys like this sort of format where we talk smack about an article and try to educate and entertain? If you do, please spread the word. Hit like, make a comment. It actually means a lot, and it helps the movement grow. In Health 3.0, right, we're trying to actually have more time to educate patients and support each other and be empowered to actually help people in a unique way, but also in a systems way, which means we need to rearrange our priorities as how we do things, right? If people can die in a U.S. hospital in childbirth still, then we're doing something wrong and we can be better. So, that being said, Tom Heineber, any parting words?
Kayla said she'll have a 5th baby if I'm her doula. And I just want to say, I used to play catcher in high school, so bring that baby right here, girl. Let's do this.
I hate you so much, Tom Heineber.
Go, 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 go. That's the birthday.
I just can't even believe I do this with you guys.